With us today, Chip Munna, coordinator with the New Hanover Regional Medical Center Trauma Services. So we're talking today about how to keep not just kids, but I guess everybody safe for this 4th of July holiday season. When Gannon was doing weather, I was talking with Chip about my own mishaps with fireworks. And I said, so are they still as prevalent today? And I mean, fireworks are still popular, so people are still having accidents.
Yep, making maybe not so great choices sometimes.
Yeah. Now, as far as the accidents that you see, is it still, we're talking firecrackers, sparklers, that kind of thing?
Burns is the #1. About 60% of fireworks injuries are burn related.
How quickly are we talking that people can get significantly burned with these things?
You know, something as simple as a sparkler, that's actually one of the hottest fireworks that burns for a long time, and it burns at 1,200 degrees.
Wow.
And so 1,200 degrees, water boils at 212 degrees. And so we're talking a lot higher. Glass melts around 900 degrees.
Good, nice.
So easily can burn your skin, burn through your skin, give you significant injuries, and infection after that. So
when people are out there, we've got a graphic up now, it's giving you some statistics on just what you're talking about. There's the 1,200 degree Fahrenheit right there. You know, people at the beach, people are usually out of their own element when these things happen. Sometimes it may be in their backyard. But as far as on scene, if something were to happen, what are the best preventative measures once an accident does occur?
If an accident does occur that can't be prevented, which they all can, the biggest thing is to cool down the burn first with water. Don't put salves or ointments or anything on there. And then make sure the person's safe and make sure there's not going to be a fire hazard because grass and bushes and shrubs, if they're caught on fire, get away from all that. Call 911, have the fire department EMS respond and take care of that piece. But the biggest thing is cool it down with water and then determine if you have to go to the hospital or not, and if so, call 911. When
you get around these holiday seasons and the number of accidents go up, are you noticing that it is children, or is this more where people my age, maybe in their 20s, 30s, where they're the ones having the accidents?
It's everybody, actually. The kids run around with fireworks, and that usually causes their injuries. Adults, a lot of alcohol's involved, and so they're shooting fireworks and doing things that they think is fun, but they're drinking at the same time, and it's slowing the reaction times and making bad choices, so then they get hurt or hurt someone else with the same fireworks.
Yeah, and you talked about how the majority of these accidents can be prevented if people just, again, just use common sense.
Essentially, all can be prevented. Follow the directions. Ideally, go out and just watch the professionals do the fireworks show and have a good time that way. But if you want to do them at home, follow the local and state laws and just make sure you read the directions. Have adult supervision. Have someone that's not intoxicated doing the fireworks show and make sure there's nothing flammable like bushes and grass around.
And when you see an injury, I had mentioned I had a firecracker that went off in my hand when I was young and still remember it to this day. At what point do you need to think, you know what, I can't take care of this here, I got to get somewhere?
So if you do get injured, if it's just a slight burn and it's a small area, it's probably can be taken care of at home. But if it's on a joint and you burn your finger, then you can actually have restriction and cause problems down the road. Or of course anything to the face, if there's an explosion, which hopefully no one's playing with those because they are illegal, then you can have actually ruptured eardrums and other damage as well. So eye injuries are pretty common, unfortunately. So anything like that, you really need to go to an ER.
All right, Chip, I appreciate the information.
Thank you.
Have a safe holiday yourself.
Everyone have a safe holiday. Thank you.
Very much so. All right.